When we think about substance use disorder, it's really a brain illness. It's, for many people, a chronic medical condition that needs treatment. And if I were to sum it up in a very simple terms, this is unfortunately how the brain responds to getting a certain substance or chemical. When we have certain chemicals that then interact with that receptor and change it, we get this flood of dopamine. So intense of a flood, the brain starts to rewire itself to seek it. Now they're using the substance not because they want to feel a certain way, but because my brain and body have become so dependent on it, I need this just to do basic stuff.
Welcome back to the Complete Reset with Dr. Quinton Moss. So far on this show, we've talked about depression, thoughts, and how brain adapts over time. But today we're addressing one of the most misunderstood and stigmatized conditions in all of healthcare, substance use disorder. Not a lack of willpower, not a moral failure, not a character flaw. Today we're talking about what addiction actually is, what's happening in the brain, and why it's often so tied to mental health conditions, and why recovery looks very different today than it did even a decade ago. So let's get into this. I'm so excited to dive into such an important topic with you today, Dr. Moss. It's also great to see you again.
Yeah, great to be here again. Thank you.
Absolutely. So as we chatted about prior to starting the show, I'm really interested in addiction and substance use. And one of the things I'm really excited to learn about is how it's changed over time, because that's something I hadn't heard before. So but- we'll jump right into it. So, Dr. Moss, when people do hear the word addiction, many people still think in a moral or behavioral terms.
Yeah.
But from a medical and psychiatric standpoint, what actually is substance use disorder?
Great. Thanks for the question. And I'm glad that you used the term substance use disorder. Most of the public doesn't know that term, but that's the clinical term that we're using. And we believe that that term also carries with it less stigma. So when people hear addiction, they also, on the back end of that, saying, well, why can't you just stop that? Just stop from doing that. This is, as you mentioned before, many people believe it's a moral issue. But when we think about substance use disorder, it's really a brain illness. It's, for many people, a chronic medical condition that needs treatment. And if I were to sum it up in a very simple terms, this is unfortunately how the brain responds to getting a certain substance or chemical. Not all substances and chemicals, create this response that the brain gives in regards to the feeling that it gives and the drive to be able to continue to have that exposure. Not every substance or chemical does that, but there are many out there that do. And that's kind of the drive what's behind, substance use disorder, the brain's interaction with this particular chemical.
It's a different way to hear it explained that way because it's not often talked about in that regard whatsoever.
hmm
And, can you walk us through what substances actually do to the brain, particularly the reward system and executive function? And why does decision making change so dramatically over time?
Yeah. So if I were to begin, where would I say is the initial target of the substance? Whether we're talking about alcohol, we're talking about opiates in the form of fentanyl, or whether we're talking about meth, we're actually targeting a part of the brain that deals with reward and drives. This is in the ventral tegmental area. The nucleus accumbens is a little bit more specific. And in that area, we have receptors that unfortunately interact with these chemicals in the brain. And when those chemicals interact with those receptors on that neuron, oftentimes it creates this release of another chemical in the cell. And for most of these substances, it's related to dopamine.
Well,
Dopamine is this powerful brain chemical or neurotransmitter. It's associated with our mood. It's associated with being able to maintain attention and motivation. It's associated with movement. And unfortunately, is also associated with substance use disorder. We interact with receptors that release dopamine all the time. So if I were to get my favorite food and I were to eat it, I would have a release of dopamine and I would feel good about eating that food. If I were to have sex, I would also have the release of dopamine, right? And then I would have a good feeling. It's something that's naturally within us that releases a good feeling so that we go back and we do that thing over and over again. So we need to continue to eat. As a species, we need to continue to procreate. So that's why sex is good. However, when we have certain chemicals that then interact with that receptor and change it, we get this flood of dopamine. So intense of a flood that the brain starts to rewire itself to seek it. So one half of this is this pleasure that we're experiencing in this nucleus accumbens that I talked about, and this desire to want to experience that over and over again, but becomes problematic because now that area sends projections or pathways now to our prefrontal cortex where we start to make decisions, where we start to plan, where we start to prioritize.
mm,
So the decisions that we used to make about how to do something one, two, three, or this step after another, or my obligations or things that I have to take care of, those things have now been compromised because what we have in the nucleus accumbens, sending those projections to this executive center, my priorities now are how do I get more of that substance? How can I feel that way again? And this creates a very, very start of a nasty loop. And that's why I say that it's a brain chemical issue and not a moral failure issue. If we have a part of the brain that has now been compromised because of the projections from this pleasure area, it makes it very difficult to make a clear decision. It makes it very difficult for us to prioritize. Those other things that are valuable in our lives, when we think about work, relationship, even children, it's not that we don't love them. It's not that, they're no longer a priority. But unfortunately, the brain has now been rewired to seek other priorities because of the substance use. So that's one part of it. And this kind of varies slightly from substance to substance.
yeah, I'm curious about the substance to substance because I know that depending on the substance, I think certain parts of your brain chemistry are altered differently,
Hmm.
I believe. But even beyond that, I think that oftentimes with substance abuse, they're usually linked to or have some correlation with depression or anxiety or things like that. So,
Yeah.
in your clinical experience, how often is substance use disorder actually tied to these conditions like depression, anxiety, trauma, or bipolar disorder,
Oh
for
gosh.
example? And
Yeah.
why is it so important that they're treated together versus one at a time, or is that not the case?
Man, you've said 4 hours worth of questions right there. So really,
Let's
there's
dive in one at a time.
yeah, there's a whole lot to unpack there. So
Yeah.
where should I begin with this? Let's say about this dual diagnosis thing. Let's talk about how people can have substance use disorder, whether we're talking about alcohol use disorder, opioid use disorder, stimulant use disorder associated with methamphetamine. But people can also have depression, anxiety, as you mentioned, bipolar disorder, and also ADHD. The studies show that probably somewhere between 40 and maybe 60% of the people may have another mental health condition that
Mhm.
goes along with their substance use disorder. However, in practice, I find that it's over 90%.
Wow.
So if you don't have, one scenario is I've had this underlying depression, anxiety, ADHD or bipolar disorder or PTSD. I've had that underlying. And because of that, my circuitry, it sometimes craves something to help me to feel better. And
Mm-hmm.
then I have this substance use disorder, and they kind of run together and they have to be treated together. Another scenario is that someone may have substance use disorder, but living with substance use disorder is a hard life, often associated with incarceration, often associated with violence, often associated with losing friends and loved ones even around you. So there's a great deal of trauma that might be associated with having this condition. So now people on top of that develop depression, anxiety, possibly post-traumatic stress disorder. So those are a couple of scenarios where people can have substance use disorder and another mental health condition.
Mm-hmm.
Old school way, and probably the way that some treatment centers still operate, is that they have the personnel and the staff and the expertise to treat the substance use disorder, but they
Mm-hmm.
don't have the appropriate providers, therapists, and expertise to treat the mental health. So they'll prioritize the substance use disorder. We'll go make sure that we're able to detox someone. We'll give them the appropriate medication. We'll give them the appropriate structure. And they hope that they can make some ground on helping them to move towards wellness. But if we're not addressing the depression, the anxiety, the racing thoughts, possibly if people have other psychotic symptoms, if we're not addressing that, that person has a much higher risk of relapsing early in the illness. So when someone comes in the door, first day, we have to find a way, of course, to make sure they're safe and stable with their substance use disorder. But we have to get some understanding quickly of what else is going on with their mental health so that we can acutely address that as well. So that's what we do at my practice. Day one, we're addressing both of those things, and we believe that we get good outcomes.
Absolutely. It's so interesting because I know you touched on how that may be, well, it's your practice, but it may be newer when you mentioned, the old school way is just to fix the substance abuse without fixing the other things, but they go hands in hand. One fuels the other, I feel
That's
like.
right. That's
If you're
right. It
suff
does.
if you're suffering from a traumatic experience or some sort of trauma, or you're depressed or you're anxious, a lot of ways that people escape that is through substance use and or substance abuse rather. And if you are struggling with substance abuse, you're causing all these other things within yourself to these other conditions. So it's such a two-way street that if you're not fixing the entire issue and, disorder, then what, it's rare that you'll really be healed. Like you said, you'll more likely to relapse.
Mhm.
So it's interesting that that's a newer concept versus how it's been the whole, prior to modern day. But I think that there's also so much more knowledge and awareness about mental health now because mental health itself was so stigmatized. So we're
Yes.
dealing with mental health disorders that are stigmatized and addiction or substance use disorder that are stigmatized. So maybe there was just one or the other in that sense. So interesting to think about it in that regard. And in terms of how people think about substance abuse disorder, a lot of people or a lot of, families or friends that are experiencing a loved one struggling with this, I think most people think, well, why can't they just stop
Yeah.
hurting them? So why are you doing it, right? So what do people really need to understand about compulsive behavior once the brain is already altered?
Yeah. So, we tend to think that people are making a choice. They're
Mhm.
making a choice, to continue to use. And I think that we're able to make a choice when we have a fully functional brain. We're able to make a choice. But
Mhm.
if we don't have a fully functional brain, we're not really able to make a
Mhm.
good choice or make good choices. And so when a brain is, full blown in substance use, the ability for me to depend on the part of my brain that drives executive functioning, that allows for me to plan and prioritize. My ability to depend upon that part of the brain is compromised. And unfortunately, the substances have rewired the brain to that degree, so much so that it usually takes, possibly, months for some people, and maybe years for others, for their brain to get back to the way that it would typically function. So our ability to make decisions are compromised. Our cognitive flexibility, meaning being able to see things from different viewpoints, is compromised. Our ability to problem solve becomes terribly compromised. Our ability to cope becomes compromised.
Mhm.
So if we're dealing with stress, typically we have maybe some positive coping mechanisms that we can use that can help us. But once we've started to use the brain, which is very smart, realizes that by using a substance when I have a problem, it makes me feel better quickly. So the brain now by default will look for that way to be able to cope with a situation or a problem. So much so that if someone is significantly stressed, not only will they have the thoughts about, man, I could fix this by using this substance, or I could fix this by getting this drink. Not only will they have the thoughts, but the brain is so in tuned with the body that the body will also respond with symptoms that drives them to want to use the substance when they have stress. So it's more than, hey, I want this because I want to feel good. The wiring for the brain and body are also involved. The other piece that makes it difficult for people to stop is not only how the brain is compromised, but now the wiring is changed such that it needs that substance to function.
Mm.
And so without that substance, people start to go through withdrawal. And that withdrawal looks different based upon the substance. For some substances, it is people just really become super irritable, super depressed, possibly suicidal. People are not able to sleep. They become restless, nausea, vomiting, muscle aches. They may experience all of that with their withdrawal. But with other substances, the brain and body have been so wired to become dependent on it. If they don't have the substance, they can go into seizures. And people can actually have, an instability of their blood pressure and heart rate. They need to be in the ICU. For certain substances, there's like a 15% risk of death and people trying to detox on their own. So these are, a culmination of things that start to add up that make it difficult for someone to move away from using.
Absolutely. And I think that when you were talking about the mental aspect of it, I was thinking about your body also is now involved, and it's
Right.
more than just a mental capacity, it's a physical thing as well.
Hmm.
And it's even like you just said about withdrawals, even if someone wants to do better and wants to try to detox and get off the substance on their own, they can also hurt themselves as well. So it's never that easy to just say, why can't they stop? I think anyone wants to particularly be in that position. So it's hard. It's hard for the people around the person who's suffering from substance abuse, and the person who is going through it physically and mentally as well. So it's just it's hard.
It's bondage. And I think about mothers and fathers who suffer from substance use disorder
Mhm.
once they get towards near the end of the illness, and they may still have their kids, they might still have a job, and now they're using the substance not because they want to feel a certain way, but now they're using the substance so they would not get sick. So
Mhm.
I'm using the substance so I can get off the couch and get my kids off to school, or I'm using the substance so I can make it through 6 hours at work, not necessarily trying to chase a high, but because my brain and body have become so dependent on it, I need this just to do basic stuff to make it through.
It becomes survival at
It
that point.
is.
It really is. And I grew up in a household with addiction. So I understand that completely. And even saying addiction, I know that that's something we used to refer to substance abuse disorder as previous to modern day. And we touched on this briefly about how it's not the same today as it was in prior years. So, how is addiction not the same today as it was 10 or 20 years ago?
Yeah. So if I were to pick, maybe let's talk about opiate use disorder.
Hmm.
20 years ago, we had a large percentage of people who suffer from the illness who were addicted to pain pills, Vicodin, Percocets, Norco that they would get from, or Oxycontin that they would get from their prescriber. That was one segment of the population. Another segment may have been using heroin at some point, to be able to control their pain or to try to manage their withdrawal symptoms. Both pockets of people, very addicted. However, probably within the past, 10 years or so, we've had a transition from people using as much of the pain pills and even heroin have now gone on to these high potency synthetic opioids, the fentanyl being one of those. The potency of that is many-fold more potent than what people were using or abusing, 10 to 15 to 20 years ago, interacting in the brain in a much different way. Not only that, but also significantly increasing the risk of overdose. We've
Yeah.
had some leveling off and maybe some reduction in overdose deaths over the past couple of years, but it still remains a big problem in people being exposed to things that are far more potent now than what they were 15 years ago. Even if we were to look at methamphetamine, the amount of methamphetamine that we're producing now with the potency is far more potent than with methamphetamine that was 10 years ago, which makes it that much more difficult to release ourselves from its use. We think about alcohol. Alcohol 20 to 30 years ago, we didn't have as many flavors, as many alterations, as many brands. Brands now of alcohol that look like soda cans
Hmm.
that people have quick access to, often, unfortunately, at younger ages, and people suffering from substance use disorder. Even if I would think about the next substance and think about, cannabis or marijuana, the cannabis or marijuana with the THC concentration, the potency of that, we think about what that is now compared to 20 years ago is 20 times more potent.
Oh.
And so everything that we've been abusing over the past 50 years, either we've adulterated that people can get more easier access and it's packaged in such a way that becomes more acceptable. That's one. Or two, the potency has been increased manyfold, making the treatment and response to, substance use disorder that much more difficult.
And I have a question on that in terms
Yeah.
of the potency. Is that just because things have been mixed and combined into a substance versus before the substance may have just been
Mm.
substance? Is that what's different?
So that's a good question. So is it because things are being combined that weren't combined before, or is the substance itself getting more potent? And so it's both of those things. So we have this globalization of chemists who are able to come out with various compounds, but also continue to adulterate previous compounds to make them far more potent. So that's going around globally. We can genetically, affect the strains associated with marijuana so that we have a THC concentration that's increased, and then we can further do things with the plant and how we process it to get a much higher potency. So those things are true. But the other side of that is the deadly component of it that increases. And that is we're still able to have fentanyl and sometimes methamphetamine mixed together We have cocaine, which sometimes may be mixed with opiates together,
No.
and that increases risk. And even in our supply in our neighborhoods of marijuana, some of that is even still adulterated, and there's some risk. So yes, we do have now the melting pot of substances in a way that we did not have before 20 years ago.
Mhm. And it's one other thing that you said earlier was about, for example, pain meds like oxycodone and things, those kind of drugs. And I think that when people think about substance abuse, it's always cocaine or heroin or all these, I don't know if street drugs are the right term at all, but
Yeah.
these, drugs that you don't get from a doctor essentially. But a lot of people can get addicted and have struggle with substance abuse from pain meds from their doctor. And that's a whole nother avenue of substance abuse and why it's so layered and it's so complex and so hard for so many people to really understand. But people do get addicted to those things all the time.
And that's probably where we saw um, the biggest boost early in the opioid epidemic was through, how we prescribed opiate pain medication. And there wasn't as much regulation of it then as there is now, far more highly regulated now than it was back then. But I think that that was the boost for the opioid epidemic. But even today, if you were to go get pain medication from the emergency room or from your prescriber, certain people may be at risk.
Mhm,
Even in getting the typical prescription, some people may be at risk for still developing a substance use disorder. And it is not a moral call on their part, but there are a number of things for us that increase our risk of developing substance use disorder. We can have 10 people who are lined up, all well intentioned, and we give all of them pain medication. And unfortunately, there may be a couple of people in there because of their risk factors who may end up developing substance use disorder.
mhm. And when you talk about risk factors, are those kind of some of the disorders you mentioned earlier, like depression, anxiety,
Yeah.
ADHD, bipolar disorder? That's a huge contributing factor, right? When people are. Mhm.
So those other mental health conditions we believe may increase the risk, right? Because sometimes mental health conditions and the substance use disorders, they kind of run together for many of our people. But there's some other things that increase, risk. If we grew up in a family where substance use is normalized, it's
Mm,
just what we do, right? It's just what we do to cope. Dad worked very hard at a factory job or at the office, and he came home and he put away 6 to 10 beers every night. That's just what we did, right? And you see that. So that becomes normalized behavior. So that increases your risk also for perhaps looking at that is the way that a lifestyle is supposed to be, or that is the way that we cope. If we
mm,
grow up in environments where there is ample access to substance use disorder, of course, that increases our risk. One of the things that we find that is very common is that when people have significant adverse life experiences or trauma in childhood, that significantly increases the risk. It doesn't make it automatic, but it substantially increases the risk. And the way that it increases the risk is in a way that many of us may not think about. It's not that this person has suffered a trauma and they have these symptoms and they're looking for a way to self-medicate those symptoms. That's one way. But the other piece is that, when we suffer these things as children, it changes from that point how our brain is wired.
mm,
And so we think about things such as dopamine. I talked about how that's the feel good chemical in the brain and a neurotransmitter. Well, some people who've suffered trauma early enough, and if it's severe enough, they may not be able to get the same effect from dopamine that other people might.
mm,
Some people feel great with being able to go outside and play basketball, to come home and eat a great meal, or to hang out with friends and they get a boost with their dopamine and they feel great with that. But some people may have those same experiences and they don't get as great of a feeling.
Wow.
They actually got to go harder in order to get the great experience. So they're over the top in trying to get pleasure. And sometimes substance use gives them that feeling that they may not necessarily naturally get because of, how their brain has been changed.
Wow.
Another way that brain is changed is that, there's a part of the brain called the amygdala that kind of helps monitor stress and manage stress. That part of the brain actually gets altered when people are, in childhood with enough stressors or trauma. And so the capacity to be able to manage stress or triggers of life gets compromised. So people aren't able to cope as well. And so people become more symptomatic or become more easily overwhelmed with, some, daily or life challenges. And so they're looking for ways to be able to cope and manage with that. And for some people, substances offer that. So I say that to say that, when we think about, why do people become, you know, addicted or they start having substance use disorder, we can think about, early childhood experiences. We can think about exposure to substances and the environment. We could think about normalized behavior. I'd even speak about genetic risk and
I
that
was going
there
to
are
ask that.
genetic risks associated with having family members who are unfortunately suffering from substance use disorder, and then your risk is increased. All of these things come to play, which makes it an uneven playing field as
Hmm.
to why this 16-year-old kid who decided to chuck back a couple of beers with his friends, when they shouldn't have, but they're doing that, but one out of that bunch takes a serious liking to that because their brain and their experiences have been so much different. So,
Absolutely. And speaking about, addiction and substance abuse disorder, you've highlighted that methamphetamine use disorder is neurologically different
yeah.
from other addictions.
Yeah.
So, what makes meth so challenging from a brain and recovery standpoint? And why do expectations need to be different for this particular disorder?
Well, I will say this, that let's talk about how it's a little bit different. When I talk about alcohol use and when I talk about, even with opioids, with fentanyl, heroin, pain pills, when they go to, affect the brain to release this dopamine, they actually have to attach to a receptor, and then from the attachment to that receptor in the neuron, then it starts the release of this dopamine and we start to feel good. With methamphetamine, it's an unfair player.
Mhm.
So not only is there activity in a receptor and it may cause the release of dopamine, but dopamine wants to invite every part of the cell to the party. So then it goes into the cell where we have stored dopamine and it cuts open those vesicles and allow for the release of dopamine that's being stored. Not only does it do that, but when we have two neurons that are communicating with each other and they share this dopamine, it goes in and says, you know what we're going to do? We're going to make this super saturated with dopamine. So anytime that a cell tries to reabsorb, to recycle this dopamine, we don't want to recycle it. We want to use it all so it stops the dopamine from being recycled. And then further, it tries to block the dopamine from being broken down. So all of these pathways that we have safeguards to kind of manage and use this dopamine efficiently, methamphetamine has a target to now flood the brain with a lot of dopamine. And with that comes significantly compulsive use. Also, with that comes with it the increased risk of psychotic symptoms. So people can start to have symptoms that resemble that of someone who may have schizophrenia. They don't necessarily have schizophrenia. It's their brain now being affected acutely and sometimes long term with this methamphetamine. And then the challenge for us as providers is that we don't have an FDA approved medication to specifically treat methamphetamine use disorder. We have medication specifically for alcohol. We have medication specifically for opioids and fentanyl and pain pills, but we don't have an FDA approved medication that is specific for this condition. We use a combination of medications to try to help people along, and we've had some success with that, but the field still has a long way to go as far as trying to have a specific medication that can help these folks.
Well, and speaking about treatment, I think that when people hear treatment, they often imagine detox or rehab alone.
Mhm.
From your perspective, what does effective modern treatment for substance use disorder actually really include?
Mm, good question. It's a comprehensive thing. So let's just start first with let me get the patient in front of me, whether I'm a provider,
Mhm.
whether I'm a social worker, physician, nurse practitioner, whoever the provider is. Let me get the patient in front of me and let me understand what is their story. What is their story with their use? When did they last use? What happens to their body that they feel when they're not using? What are the other mental health symptoms that go along with that? Get a good understanding, really 360 of what's going on with that person. But I also need to understand what's going on in the context of their environment. Do they have a safe place in which they can recover? Or is there significant stressors where they live? Are there other people there who are also using? And a big question today is, do you actually have a place to live while you're struggling with this condition? So I'm looking at the biology, what's going on. I'm looking at the mental health or the psychology of what's going on. I'm also looking to make sure what other medical conditions that they have, which is going to affect my decision, and then the environment in which they're living and the support systems. And based upon that, then I can counsel the patient. These are my recommendations. Maybe we need to start with inpatient hospital because you have significant medical issues and you have great risk. Or maybe we can start with doing some form of detox, making sure that we get good monitoring and appropriate medications on board, right? Or we could do this in a residential level, but I need to find out where can I recommend this patient where they can get their needs met, that we can do this safely. From there, medications to start with the withdrawal symptoms, medications to help reduce the cravings, also, if necessary, medications to address the mental health. Medications that are going to address their other medical conditions, where they have hypertension or diabetes, all these things that have not been treated, finding a way to make sure that we take care of that. So that's the first medical piece. And now I need to create an environment where we can help your brain to remodel. The medications that I provide to help target this nucleus accumbens, I think I talked about that, the drives and the cravings for the substance. But when I talk about treatment in the forms of different types of groups, when I talk about individual therapy, being able to do work one on one, now I'm starting to work on the prefrontal cortex, helping to strengthen that part of the brain. And believe it or not, counseling and group counseling creates brain changes that we can see on imaging. So
Wow.
these things coming together for people, dosed at whatever number of times per week, for whatever duration of time, specific for that individual, helps them to be able to make progress. But then I
Wow.
have to take it further. Even from there, I have to think about long term. Where's this
Mhm.
place going to sleep? Where's this person going to sleep? Where are they going to live? What type of housing can I help them get access to? Long term, again, at some point, I got to get this person working. What type of vocational training can I help with, or vocational coaching to place them into something that once they're well enough with their illness and they're able to start working, that part's also taken care of. How do I create a mechanism that I can start the process of reunifying them with their support system or family? And that is also a task. So all of these things have to take place. in a very customized way for each individual who walks through the door. There's no cookie cutter way, there's no assembly line type way. Each person is different in how we are supposed to support them on the journey.
That is so more in depth than you would even really think about at an initial thought. So, even I'm curious a little bit about this. You touched on even group settings and how that can improve um their disorder, but that made me think of our previous episode when we talked about depression and how socializing is necessary because people need interaction. So is
Yeah.
that the same kind of concept? Is that correlated, having that group setting where maybe people can relate to what they're going through, or having that socialization? Is that what helps in that
So,
scenario?
so yes, there are two parts of that. So there is the structured treatment part where you have a trained professional who's going to relay information, whether it's ways that we can recover and manage our cravings or coping mechanisms, or how we can have more effective communication, or how do we manage our mental health symptoms. All these, tools, over time that we're going to give individuals, which helps them, move forward. And they're doing that with their peers, who are also going through the same thing. Very powerful dynamic there for treatment.
Mhm.
But the other part of that is informal group settings where people recover. So now we're talking about Alcoholics Anonymous, we're talking about Celebrate Recovery or Smart Recovery, where people can get access to people in the community who are on the spectrum of recovery. You can have someone who says, you know what, I used this morning and I'm trying to get my recovery started. And they may start there, but you may have someone there who has been well for 20 years, and they're also within this same group. So, you get, life lessons learned, you get support, you get acceptance, which is a big thing. And so that all, I think, kind of pairs well with treatment and helping people to be able to move forward. So,
Absolutely. And you mentioned certain medications to help with certain disorders and certain substance abuse.
mhm,
So, and I know we'll be dedicating a full episode to this later
mhm.
in our series, but regarding medication assisted treatment, also known as MAT or MAT, but at a high level, why does MAT play such an important role for so many people, and why does it improve outcomes?
Well, I'll say this. If we had to think about the primary thing that we want to do with people who are suffering from substance use disorder, what is the primary thing that I want to accomplish, right? If I had to say that the primary thing that we want to accomplish is to keep people from dying. That's the primary thing. If I would say what's the one thing for sure that we want to make sure that we accomplish, and that is to keep people from dying from complications of their use or dying from overdose, right? So that is what we want to do. And these forms of MAT have been proven to help with that. So by us providing this treatment, we're able to help people, have hopefully reduce use and reduce risk of death and other complications, including the transmission of certain diseases. So MAT helps definitely with that part. The other part is that I have to find a way to biologically, while they're trying to refuse from using, I have to find a way to be able to help detox them and to also substantially reduce their cravings to want to continue to use. And the forms of MAT help us be able to accomplish oftentimes both of those priorities. So it's a very helpful tool to be able to help people to be able to move forward with what may be for some a chronic condition,
Hmm.
much like we have insulin for the person who suffers from diabetes, like we have blood pressure medicine for the person who has hypertension. These are tools that we have in medicine to be able to help people manage this condition.
Absolutely. And I think that that makes it so much more of like less stigmatized
Oh,
when
yeah.
people are looking at it from that regard, as it is a condition similar to any other condition versus the stigmatized negative thing that you may have caused yourself, so to speak. It takes away from that stigma and makes it so much more of, like you said, a condition like anything else, like diabetes or anything else that requires medication. And I'm definitely looking forward to that episode to learn a lot more about that. It's something I hadn't heard about before.
Hey, Layla, I want to, if I could,
Mhm,
speak
absolutely.
about, this whole thing of chronic disease model. We often think of, chronic disease as being like high blood pressure, diabetes. People have had heart attacks and they're going to have a condition that they're going to have to manage over time. And, substance use disorder for many people, not everyone, right? And everyone has their own path in recovery, and I deeply respect that. But for many people, substance use disorder may end up being like a chronic disease.
Hmm.
And so we have to take medication for a period of time, and for many people, ongoing to be able to manage, this disease.
Right.
Another aspect of chronic disease is relapse. So when we suffer from congestive heart failure, and we don't do the lifestyle changes that are necessary for that, whether it's fluid restriction, changing how we eat, or making sure we're taking our medication, we suffer a relapse, and our lungs get filled with fluid, or our heart is strained, and we end up in the hospital. Same thing
Hmm.
with diabetes. We have periods which we're managing our diabetes well, but unfortunately, we may go through a spell where we don't do as well with our eating, and because of that, our body suffers, and medications have to be adjusted because there was a relapse associated with the condition, much like also with COPD.
Hmm.
Substance use disorder is also an illness of relapse. And if the relapse happens, it is not a call to action about the morality of that person, the good or bad of that person. It's a call to action about what do we need to adjust with the environment, with the treatment, with the supports, so that we can help the person to kind of pick this back up again.
Hmm.
So when people see people who are in recovery and they're working hard towards wellness, and they see that there's been a relapse or a use of a substance, many people throw their hands up and say, "Why is this happening? This is such an awful thing." And they point the finger at that person, tearing them down oftentimes, and saying, treatment does not work. Treatment does work.
Hmm.
Unfortunately, relapse is a part of the steps in folks getting better. And we're trying to find ways that we can wrap our arms around them and give them the resources necessary so they can continue to march towards wellness, and be all that they need to be.
Absolutely. It's sometimes not a straight line, right? Like sometimes
No, right.
it goes hand in hand. And just because you do relapse doesn't mean you can't try again. It sometimes no one's perfect.
No.
Even taking that first step to try, I think is so important.
Hmm.
And, I think it's hard with relapsing because it must be so hard on that person who's been trying and trying to feel so let down by the relapse. And for those around them who may not understand, it's super frustrating too. So it's hard, but it is, like you said, very common, and it's not end all be all by any means.
Exactly. Exactly.
And talking a little bit about outpatient programs, can you maybe describe how integrated outpatient programs like the Genesis program, for example, support recovery differently than fragmented care? And what does coordinated whole person treatment look like in practice?
Oh gosh. So I think the Genesis program, here at Modern Psychiatry and Wellness is, I think, the best example of that.
Mhm.
So we have recovery housing where people have a place to live, but we have this treatment that begins with one, let's evaluate what your life story has been. How have you had challenges? What's the substance? What's the mental health? What's the background stuff that may sometimes kind of lend to people suffering from substance use disorder? We want to evaluate that. And much like how I described how we wanted to have the appropriate group treatment that's necessary, we also want the appropriate individual treatment that's necessary. We also want to incorporate the mental health treatment from day one We bring all of those things to bear to make sure that we're able to start to stabilize the patient. And on top of that, we have primary care, primary health solutions is the clinic, and they actually come on site to make sure that we're taking care of all the medical needs of that person. You know, the high blood pressure, the cholesterol issues, the pain issues, all those things that need to be addressed. We have a primary care provider who takes care of that. In addition, for people who need treatment for hepatitis C, we're actually able to do that also on site. So all these medical things are being taken care of. So that happens. But then we also have, hey, we got to think about what life is going to look like, once people leave here. So we have case managers that are working around the clock to figure out what is the next step for this person when they leave Genesis? Will they be going back with family? Will they be going to a sober living environment? Will they be going to perhaps another treatment program? So they're always working to figure out what's going to be the best next step or disposition for the client. And then we also have Jobs Plus. Jobs Plus is a one of the ministries associated with City Gospel Mission. And so they come on site and they try to prep people for interviews and resumes and get connections for people can start thinking about vocation and work, after they leave the Genesis program. So that's yet another bucket. But it continues. We have a nice partnership with Sensory Recovery. It's a not-for-profit, and they come in and they provide functional fitness for the clients. So they come in and they start providing exercise regimens with the equipment to start working with people because we find that when people exercise, not only do they physically start to feel better, but it also treats depression, but it also helps reduce cravings associated with substance use. So we have that component as well. And then what I think is also the secret sauce is that this is all done in an environment where people can get more in touch with their spiritual lives.
Mhm.
So this is all within the confines of being a Christ-centered, mentoring program where people who want to explore that part of their faith will have plenty of opportunity to do that with the additional supports that we have baked in to our programming and supports. However, if people don't want that approach, they don't want the spiritual stuff, they don't have to. And we're able to support them with what other needs they have as well, whether there's no spiritual leaning at all, or whether they have another faith. We also find ways to provide them with the resources that they need to grow and improve their spiritual lives. So if you think about treatment and all of the components that are necessary, Genesis is very dear to me. I try to go over there, speak as often as I can and engage because, seeing those men and women make these steps in this environment is so energizing for our clients, but also for our staff. For us, this is the best thing going, and we're proud of the program and the staff who work in it.
Absolutely. I could imagine that for staff and for you and for those involved, it being so rewarding to see how people are changing their lives and being able to really help them with that. And I think people who do go ahead and seek out this help is they're so brave because it's so hard to really realize that you need help. So taking that first step to actually be in the Genesis program or similar programs is such a huge step. And I think that I'm fascinated by this because, like you're talking about the Genesis program, having really all those different dynamics, because those are all the dynamics that you need to really kind of get grounded and really restart in that sense. Job help, fitness, all of these different things. So a lot of places don't offer such, overall comprehensive, I think, program. So that is amazing. So maybe we can actually link some information about the Genesis program in the show notes as well. But I definitely think that this episode was so powerful. And addiction is not a failure of character whatsoever. It's a condition of the brain. And like any other medical condition, it really deserves the understanding and compassion and evidence-based care. So if today's episode resonated, make sure you follow the complete reset so you don't miss what's next. We have so many good episodes to get into in coming weeks. And thank you again, Dr. Moss. I think this has been such a great episode. Like I said, I'm so excited to dive into more episodes with you. And we'll make sure all the information is linked below.
So thank you for, sharing the message so that people can break that initial, bondage of this condition. And the first bondage is the stigma.
Mhm.
Working through that so people can make some decisions regarding treatment. So
Absolutely. I'm happy to be here to help break the stigma. So share this episode with anyone you think can take anything away from it, whether they're struggling, whether they know someone who's struggling, whether they know someone who's previously struggled, or just share it because the more people have this information, it helps to really break the stigma universally. So thank you all, and we'll see you next time. Thank you again, Dr. Moss.
bye-bye now.